In most cases, tinnitus doesn't mean that you need to be seen by a physician. But in today's video, I'm going to be sharing 8 tinnitus warning signs that need to be addressed by a medical professional and should not be ignored. At the end of this video, I'm going to share some signs that indicate that tinnitus isn't a medical problem, as well as what you can do about it. All right, let's jump in. If you're in a serious accident and experience an injury that results in tinnitus, especially a head injury, could be a sign of a TBI, or traumatic brain injury, and you need to have that assessed right away. If you experience tinnitus along with a sudden loss of hearing in one or both of your ears, you need to make sure to have that looked at by a physician. This could be the start of a sudden sensorineural hearing loss. If that's not treated quickly, it could turn into a permanent hearing loss. Sudden hearing loss is typically treated by an ENT or ear, nose, and throat physician, also known as an otolaryngologist, and it's typically treated with a steroid injection into your middle ear. Sudden hearing loss that's treated later than 2 weeks after the onset is much less likely to recover. This could also be the sign of Meniere's disease. Common symptoms of Meniere's disease are fullness of the ear, hearing loss, vertigo, and tinnitus. Finally, this could be an indication of an acoustic neuroma, which is a type of tumor that grows on the auditory nerve and compresses that nerve, leading to hearing loss and, in some cases, ringing in the ears. All right, the third sign that you need to see a physician for your tinnitus is if it's accompanied with facial weakness or facial paralysis. This could be an indication of a condition called Bell's palsy. Tinnitus along with facial weakness can also be a sign of Lyme disease. This could also be the indication of a condition called Ramsay-Hunt syndrome. Tinnitus, anxiety, and depression, unfortunately, often do tend to go hand in hand. The conditions tend to make each other worse, causing you to get into a reactivity loop with your tinnitus. What happens is, first you hear the tinnitus, then you have a negative emotional reaction to the tinnitus. The limbic system in your brain says, this tinnitus must be important, we better pay attention to it, which causes an increased fixation on the tinnitus, which reinforces the negative emotional reaction, and on we go. And if that emotional reaction tends to lead to depression or anxiety, we get into this really nasty cycle. If you're experiencing extreme anxiety or depression related to your tinnitus, it's important to go to a physician, ER, or mental health professional, because this isn't something that you want to try to deal with on your own. According to the Centers for Disease Control, about 15% of Americans experience tinnitus. That's about 50 million people. Of those, the vast majority do not experience debilitating tinnitus. It's estimated that about 2 million people in the United States live with tinnitus that's causing a significant impediment to their quality of life. If you're one of those people who experience bothersome tinnitus, you know that it can impact every aspect of your life. However, it's really important to know and understand that in almost all cases, tinnitus gets better over time, and there are professionals that can help you manage and reduce the level of the tinnitus. So if you're experiencing tinnitus that's causing you to consider self-harm, you can dial 988 for confidential support, and make sure to reach out to a qualified mental health specialist so you don't have to go through this alone. Sign number 6 that you need to see a healthcare professional for your tinnitus is if your tinnitus pulses with your heartbeat. Pulsatile tinnitus can be caused by vascular malformations, abnormal cerebral pressures, and unique blood flow patterns near the ear or the presence of a tumor. Sign number 7 that you need to have your tinnitus evaluated by a healthcare professional is if you have pain, drainage, or a foul odor coming from your ear. These are signs of a significant infection that could get worse. Left untreated, these infections can lead to tears in the eardrum, permanent hearing loss, and in rare cases, the infection can actually spread to the bone behind your ear and lead to meningitis. If you're experiencing tinnitus with vertigo, there are a range of ear-related conditions that could be causing it. This is worth a visit to a physician or ideally an ENT who specializes in ear-related conditions, also known as an audiologist, to have it evaluated. I used to run a dizziness and balance clinic, and I frequently saw that patients who had dizziness were misdiagnosed by physicians. This was especially true about physicians in ER settings. So if you go to the doctor about your dizziness and tinnitus and don't get satisfactory advice, don't give up. Keep looking for a physician who can help you understand what's going on. So, if you have tinnitus and all of the following are true, the tinnitus is a constant sound that does not pulse with your heartbeat. You do not have ear pain, drainage from your ear, or foul odor coming from your ear. You do not have vertigo. you do not have weakness or paralysis of any muscles in your face, and you do not have a sudden unexplained hearing loss, then you should see an audiologist, and ideally an audiologist who specializes in tinnitus. Audiologists are non-medical professionals who can do testing and provide treatment to help you resolve the symptoms of your tinnitus so it doesn't have such an impact on your day-to-day life. Seeking help from a professional will arm you with the tools and resources that you need to manage your tinnitus and reduce how long it takes to retrain your brain to ignore that tinnitus.